So now I would like to show you all the new staff orientation for my organization, Therapeutic Connections. This is the new staff orientation specifically for our outpatient mental health clinic staff. So this is used for all of our employees, contractors, interns, and anyone else in between. So this is not proprietary. um, it's just how we do it. You can create your orientation however you see fit. This is just what I've done with my organization. We're on our 7th year of being in business, and I'll share this with you. I think you can learn a lot from it. So to start it off, this is our organizational chart for the year 2022 to 2023. It breaks down everything from the top all the way to the bottom. Normally, when I am doing these trainings with individuals that are new hires to the organization, I always let them know that there's an imaginary square or 2 or 3 on top of the CEO/program director, right? Because within any jurisdiction where you start your behavioral health practice, you have to go to the core service agency and let them know that you want to start a company providing services within that jurisdiction. When you do, that particular core service agency representative would have to sign a form called an agreement to cooperate. And then you send that agreement to cooperate to the Department of Mental Health and Hygiene so that they can also see that that particular jurisdiction allowed you to do that. So I reside in the state of Maryland. My practice is located in a county called Howard County. There's several counties in the state. So if I wanted to expand to other counties, I would have to go to each and every single core service agency and follow the same procedure. So that's the first imaginary box on top of the CEO/program director. The next one that's at the top is the Department of Health and Mental Hygiene. Those are the individuals that are responsible for providing providers such as myself that will accept Medicaid as an insurance payment. They provide us with the license for all of the programs that we provide services to and for. And the third one that's probably over that one, and you can kind of flip-flop them, is the national accreditation. Every organization that's a behavioral health organization within the state of Maryland has to receive a accreditation from a national accreditation body. So they look at your policies, your procedures, and ensure that you are being compliant with all of those policies and procedures, and you are implementing those policies and procedures. So just to do it in reverse, you got the accreditation body, then you got the Department of Health and Mental Hygiene, then you have the core service agency within that jurisdiction of where you're providing your services. And then you have the chief executive officer/program director. So in my organization at Therapeutic Connections, I am the chief executive officer for the entire company, but I'm also the program director for the psychiatric rehabilitation program, which falls on this side of the organizational chart chain. But as a CEO, what I do is make sure that the organization is established, that we're in good standing with the state, that all of our assessment and taxation information has been filed every year, making sure that we have insurance, that we have a brick and mortar space, but also on a day-to-day, my responsibility is to establish relationships with other community providers and ensuring that we can partner and collaborate with identifying clients that we both can service one another, clients that we can service at our organization, and also finding out organizations that provide services that we do not service, and getting our clients connected with those as well. So just kind of give and take in the most appropriate way imaginable. As a program director, I also oversee the psychiatric rehabilitation program. But right now, I am going to start to the left and go through the outpatient mental health clinic, because this training is specifically for those outpatient mental health clinic clients that we service. So under the chief executive officer, then you have a medical director. And in the state of Maryland, medical director can be a MD, medical doctor, a psychiatrist. They can also be a certified nurse practitioner as well. And that individual oversees the clinic. That individual also can do psychiatric assessments and evaluations. That individual, any issues as it relates to medication management, or recommending that an individual be prescribed medication, that medical director oversees that, as well as all of the clinical functions as it relates to the organization. Under the medical director, we have a clinical director, and our clinical director has to be a licensed clinical social worker. You can look at COMAR regulations for the state. That lets you know how the sausage is made at any and every behavioral health organization within the state of Maryland. It does not necessarily have to be a licensed clinical social worker. There's other options that can be done, but I would have you reference COMAR regulations and look under a clinical director specifically for an outpatient mental health clinic to see what those other options are. We chose to go with a licensed clinical director because a licensed clinical social worker rather, because these individuals underneath, these outpatient therapists, are all social workers. That licensed clinical social worker can train them to give them the hours that are required, so they too can have the LCSWC credentials. But they oversee our therapists that are lower licensed. The clinical director reviews all of the documentation for those individuals, for those lower level licensure individuals, ensuring that their notes are clinically appropriate, that they are measurable and attainable. The clinical director within our organization also sees clients, a small caseload, just to keep those clinical chops going. Currently, our clinical director has 10 clients, and in the past, that clinical director has had up to 20 clients, which helped out the organization a lot. Then underneath that clinical director, you would see an administrative manager. That administrative office manager handles all of the functions that occur within the office, from ordering different products such as PPP equipment, laptop computers, reams of paper, ink for the laptops, ink for the printers rather, just everything that you would need within an office to keep it functional. We have an administrative team, and we are breaking that up into chunks, but within that administrative team, they assist with doing some audits. Also, they assist with doing some human resources, making sure that everyone has their required documentation for onboarding, that they follow all of the internal policies that are spelled out within our policies, procedures as it pertains to keeping their driver's license up to speed, getting their clinical license up to speed, so on and so forth. Then we have our outpatient therapist. Our outpatient therapists are all lower level licensed individuals. However, we can have an LCSWC that can also be a licensed individual, or a LCPC. we can have all levels of licensure to be an outpatient therapist, and each one of those individuals are paid appropriately based on their licensure. So for individuals with the lower level license, they are paid $45 per session. Our folks with the higher level of licensure are paid $50 a session. It's pretty much how we do it at my organization. Now we go to the far right here, you'll see our rehabilitation specialist. This is the manager over our psychiatric rehabilitation program. Our rehabilitation specialist is a LMSW, a licensed master social worker, and that individual has to be licensed. And our individual oversees a team of rehabilitation coordinators. The rehabilitation coordinators, they meet with clients that are actively, enrolled in therapy. Those individuals, through the psychiatric rehabilitation program, we ensure that these clients we reinforce the skills that the clients are learning in therapy. For our youth, they're met once a week with their rehabilitation coordinators, and for a total of 4. And for our adult clients, they're seen a total of 6 times a month. Then we have therapeutic mentoring services team. That TMS team, they will meet with individuals. They work with individuals that are really have the most challenging behavioral health diagnostics and behaviors, as you can imagine. This is more of a one-on-one type of social skills based training for these individuals to meet with them, to ensure that they are learning the skills necessary to reintegrate themselves within society with the assistance of a behavioral specialist. One of the things about our psychiatric rehabilitation program that I did not mention was that with our adults specifically, in order for an individual to be enrolled in, for an adult to be enrolled in our program, they have to fall under what's called a priority population. They have to have a priority population diagnosis, meaning that they have to have a diagnosis such as major depressive disorder or schizophrenia or bipolar disorder 1 or 2, some real severe types of diagnostics where they are really going to require that assistance to learn the appropriate skills to be integrated into society. For our youth clients, they can generally have most diagnoses to be accepted for an authorization through our psychiatric rehabilitation program, with the exception of autism. Okay. One of the other areas that I failed to mention was our outpatient therapists that are school-based. So with our particular clinic, we were fortunate to get a contract with one of the local public school systems where we can place a therapist within multiple schools. And as they identify, as the school identifies individuals that have behavioral health diagnoses or challenges rather, they can get therapy directly within the school. Every organization should have a mission and vision statement. This is just the mission and vision statement for Therapeutic Connections. Please do not take this mission and vision statement. This is just a sample, and all of these things that I'm sharing with you all today is just a sample of what you can potentially use. But our mission statement is to enhance the lives of all persons served in a positive way in preparation for the future. So what does that mean? It means that every opportunity, every chance that we have to meet with that individual that we're providing services for, we really want to make an impact on that individual in the most positive way as we possibly can. Sometimes clients that receive services can be transient and they can move from one organization to another organization. and it can have a negative impact based on how they engaged with therapists at one organization. They can bring that on to another organization and have a negative expectation. With my organization, I really strive for the individuals to have a positive impact with the with that client, so that they can continue to set the bar really, really high for that client. So if and when the client does go to another organization, they know the expectations that they want for themselves and the type of treatment that they want and deserve and need. Our vision statement is to provide comprehensive mental health services that positively impacts individuals, families, and organizations through compassion, professionalism, and partnership. So our vision statement, for those of you watching this video, if you've ever been to Disneyland or Disney World, you know, once you get off the plane in Orlando or in California, that everything there is Disney. So the movie theaters are Disney, restaurants, amusement parks, everything is Disney. The gift shop, everything has Disney logos and so forth. As I look at my company, when I was building my company, what I wanted to do with my vision is to have everyone to be a one-stop shop. So anyone coming to receive services from us could get everything from this company. They can get everything that they need from a behavioral health standpoint under one umbrella versus having multiple agencies and companies providing them with services, because that can add on stress to those individuals. So just being a comprehensive mental health service provider really, really helps to positively impact individuals, families, and organizations. And we do it with compassion and professionalism and partnering with people and being like a behavioral health concierge service for individuals has really been some of the secret sauce to our success over the years. Assessment. So when we have a youth that comes through our program, every youth as well as an adult client they would receive a biopsychosocial in our assessment, and we really get a comprehensive background of what has that person experienced from the time they were in their mom's stomach to the time that they were born and to however age they are currently. We get all of the narrative and any of those defining moments that occurred in that individual and or parents' lives to this point, to see what areas that we need to focus on with that individual. And all assessments must be signed with the individual's credentials. So if it's a lower licensed person doing the assessment, then a LCSWC has to sign off on it. And if the LCSWC does the assessment, they are not required to have anyone else to co-sign. So we provide individual counseling, family counseling, and group counseling. Individual counseling is just a process which clients work one-on-one with the trained therapist in a space, caring, and confidential environment to explore feelings and beliefs or behaviors. And we were able to work with them through challenging or influential memories and identify aspects of their lives that they would like to change and better understand themselves and others and set personal goals and work towards their desired change. So really want to make sure that you're in a confidential environment. We do community-based work, so letting them know if they do want to meet with you in the community as a therapist, that there could be a potential for the confidentiality to be breached. If you have a laptop computer, you want to make sure that you have a privacy screen, or even if you're meeting with them in your office in a brick and mortar location, you want to also make sure that you have a noise machine so your colleagues cannot hear, or anybody passing by in the office cannot hear what you as the therapist and the client are discussing. We also provide counseling through a contract that we have with an employee assistance program. And EAPs is a short-term solutions type of services. So generally, most EAPs they have this service for employees that's an employer paid benefit that assists their employees with personal problems and or work-related problems that may impact their job performance and their mental and emotional well-being. So it's all short-term counseling for those employees and their family members as well. So again, to deal with some of those soft and less severe things, so more so like work-related issues with like stress, identifying different tools to navigate with that. And normally those sessions can be between 3 to 5 sessions, and then you're done after that. Every individual that receives therapy through our outpatient mental health clinic also receives a treatment plan, and treatment plans are done every 6 months. The treatment plan in itself provides information about the individual's diagnoses, the goal of the treatment, the different treatment options of the behavioral health diagnoses, possible side effects of medication, and the expected length of treatment. Again, treatment plans are due every 6 months. All persons served are required by COMAR to get a copy of their treatment plan. They're also required to sign the treatment plan as well. If a lower level licensed clinician signs this, their supervisor with the higher level of license signs it as a co-signer as well. If the client is receiving psychotropic medication through our psychiatrist, the psychiatrist also is required to sign the treatment plan. These are just some mental health clinic codes. These are not by any stretch all of the codes associated with an outpatient mental health clinic. There are several, and once you are granted an authorization to work with a client, these are just the most frequently used. So the 90791, that's for any assessments that are done. It's the 90791. 90834 is individual sessions. 90846 is for a family session without a client, and the 90847 is for family therapy. Currently, Therapeutic Connections, we only provide therapy treatment to the following. So Medicaid, so 24% of the population within Howard County, which is HC, are recipients of Medicaid. So it's a small percentage, like 1/4%. The other 76% receives commercial insurance. Currently, we are paneled with the following health insurances: Care First, Blue Cross Blue Shield, and United Healthcare. We also accept payments fee for service if someone doesn't have insurance, but they can afford it. And another bullet that I did not include on here is a sliding scale fee, whereas the individual, if they can't afford our services for fee for services and they don't have any type of insurance and they're on a fixed income, they would have to provide the company with specific income information, and based off that, we use a scale to provide them with the cost that would allow us to provide them with a service at a rate where that individual can afford. So we talked about fee for service already. I'm going to skip this, but all rates that we charge are all in congruence with the state of Maryland rates. We have a no-show cancellation policy. So persons served receiving outpatient mental health clinic services in the community are within the clinic who have non-emergent canceling. So for example, they can forget about an appointment, they can double book or get caught in traffic or oversleep. If they do that twice or more consecutive weeks, they'll be placed on a 30-day hold. And we reach out to that individual to see what is going on and try to schedule another appointment for them within 10 days, within 10 business days. That individual has to reach out to us, but we also have to have a follow-up appointment scheduled with that individual. If they don't contact us and schedule something within that 10 days, then we close the case. We discharge that client. However, they can come back to us, but they would have to start all the way back at go again and do another assessment and so forth to get reconnected to the services that we provide. All right, wraparound approach. So during every intake and assessment, if appropriate, we promote the benefits of the psychiatric rehabilitation, the psychiatric services through our psychiatrists. Again, going with that Disney World type of approach, that one-stop shop, that's what our wraparound service approach is about. We want to let the individual know about all of the services that we provide as a company and try to see what's the most clinically appropriate for them to get connected to immediately. Family counseling, it is really huge and really important for the parents. If we're servicing a child, it's really important for the family to be involved. Even if we're providing services for an adult, that the family must be involved, because the therapist is not going to be with the clients 24 hours a day, 7 days a week. So when a therapist is not providing services, the family needs to know, the symptoms associated with the diagnoses that the individual has, so that we can better treat that individual and that they'll have the skills in terms of how to engage that individual and not do anything to heighten the symptoms, and knowing what their family member is going through as well will be beneficial for the individual as well as the family. Group counseling, there's a clinical term called universalization, and group counseling is really important because a lot of times individuals may feel like they're the only person dealing with a behavioral health challenge or any challenge at that matter. However, during group counseling, they can have other individuals attending the group that have similar challenges as they do, and as such, can be a little bit more cohesive, and you can get to the level of acceptance and identify how can you live your life with the diagnoses and not let that diagnosis define you, and know that you're not in this alone and you also have support. For us, in terms of caseloads, if we have somebody that's quote unquote part-time, caseloads can be 10 cases. We want to have folks be able to have 10 cases as a part-time caseload. And again, you can create whatever amount you want to for your company. This is all a template. I'm letting you guys into, my blue book, if you will, in terms of how we do businesses at Therapeutic Connections. Full-time caseloads are anywhere between 25 to 30 cases is considered a full-time caseload. Interns, they can have anywhere between 10 to 12 cases. So this is all self-explanatory. Supervision. If you are a lower level licensure therapist at LMSW, LGPC, you'll be required to receive supervision once a week from a LCSWC or a LCPC that is a qualified supervisor through the state. LMSW seeking C status needs to be supervised by LCSWC. The LGPC seeking C status needs to be supervised by LCPC. All individuals seeking in-house supervision must provide the CEO with the appropriate documentation paperwork from that state, which is Maryland. Payment. Therapists at my organization are paid or reimbursed on the 15th of every month for the previous months of work. That's just how we do it at my organization. You can identify what you want at your organization. I go with that because we're a small organization. You can bill every week. It all depends on how many clients you have. It just works for us to build for the previous month. So let's say if this month is, what month are we in right now? If we are in the month of August, on the 15th of the month of 15th of August, everyone will be paid for the month of July, so on and so forth. Continuing education. Therapeutic Connections provides therapists with 40 Category 1 continuing education credits. All licensed clinicians need Category 1 CEUs, and we are authorized through the state of Maryland to provide continuing education. So this has been really beneficial for us, especially in the beginning, because as I was getting out there and building awareness of the program, I was doing presentations for all of the organizations within the jurisdictions where I knew had licensed clinicians so that they can get CEUs, but also so that they could know who I was, right? So they could know about my organization and meet me and know what my objectives were as well. I gave it to them, provided these presentations at a discounted rate, and I was able to establish some really strong relationships that I still have to this day. Collaboration. So collaborating is huge. I mean, when we think about it as a clinic, you can do so much with therapy. You have, individuals that we provide services for. We want to collaborate with our psychiatric rehabilitation program, which is our PRP. Those guys are more boots to the ground. It's more of a case management modality with our PRP. So if you think about PRP and or case management, it's sort of like an octopus. And those 8 tentacles are getting that individual connected to the different resources that are there within the community. But collaboration between the therapist and the PRP rehabilitation coordinator goes a long way and can benefit the clients and the families by getting them connected to all of the resources that they need in the community. So it's very essential that that PRP rehabilitation coordinator knows all of the services that are there so that they can properly link that individual to those services, and also for the therapist to know what are the challenges so that they can communicate what the client needs to the rehab coordinator to get them connected appropriately. Then we talk about the criminal background check. So any staff person who provides direct services or has access to client records, they must go through a background check, a criminal background check. Any staff person that will be providing services to program participants will have a background check. They will be informed of the reason for the application and will sign any acknowledgement that a background check will be made. The CEO will inform the employee, trainee, students, volunteers, or staff person of the results of the inquiry within 2 days of receiving it. So it's normally, if once I receive that proof that that individual did successfully complete the background check, I let them know that it was received. And then that individual also gets a copy of it in the mail as well for them to review. If the staff person has a history of an arrest or conviction, the staff person must provide the following in writing: the state, the age, they must state the age that they committed the crime, describe the circumstances surrounding the crime, describe the punishment imposed for the crime, including the court actions regarding the punishment, and the length of time that has passed since the crime was committed. Time frames for background checks. Again, at my organization, at Therapeutic Connections, these are our standards, but background check results are retained during and for at least 3 years following termination of employment. So if an employee leaves today, and right now this is 2022, we would hold on to those records electronically for 3 years. And then in 2025, we press the delete button. So we have access to those background records for 3 years, just in case of an audit. All staff persons must list a minimum of 3 character references in their employment applications. And lastly, every 2 years, all staff persons must get an updated background check. So they have to go do the background check all over again every 2 years so that we are current with everything that we require as a company, to make sure that, in case somebody got an infraction yesterday, we can go and get it today. Now, as the administrator for our CGIS account, in the event that somebody does get incarcerated, it goes straight to my inbox. I get immediate notification of the arrest, who got arrested and what it was for. And then it just has to align with our policies. If they got incarcerated for something that doesn't impact our policies, um, we will follow up with that individual and kind of get some narrative based off the slide before, just in terms of the history, what went on, what are the details. Immunizations. So currently all staff persons at my organization are not required to receive immunizations upon hire. Again, within your organization, you can mandate this. I choose not to do that. But with COVID-19 being in the middle of a pandemic, a lot of folks got their COVID vaccinations. They did provide me with proof of their vaccinations, but we also have a policy about that. And we have a form in terms of the procedure for folks to just check a box. Yes, I did get my vaccination. And if so, they can give us a copy of it. If they did not get the vaccination, they would check another box and say that they did not get a vaccination, and just to show that we have proof of it on file. Fingerprinting. All staff persons must get their fingerprints taken at a CJIS location within the state of Maryland. All persons, applicants must complete a live scan form provided by the organization. All staff persons, applicants must have at least one form of identification on hand when arriving to the live scan location. All staff persons must provide the CO with a receipt of the payment in order to be reimbursed. Reimbursements are dispersed. The first reimbursement payment for all services rendered. Your reimbursement will be added to your first paycheck, essentially. And this would happen on 2-year cycles again. Drug testing. Currently, staff persons are not required to receive drug testing upon hire. However, this is up to you, again, to make that decision as a business owner. Vulnerable population check. Right, so all staff persons must get both a state and federal background check, but this just recently changed to just state in the state of Maryland. So check if you're out of the state of Maryland, please make sure that you're looking at what those requirements are within your state. But for my company, Therapeutic Connections, we will not hire a staff person that has a criminal history under this policy. Anyone who was convicted at any time for any child abuse, child sexual abuse, or if the individual has been convicted at any time for abuse or neglect of a vulnerable adult, or have committed any type of insurance fraud. Decisions regarding the impact of the results received from the criminal history of the employability of each staff person for employment will be discussed with the members of my advisory committee. However, the individual's identity cannot be revealed at any time based on HIPAA regulations. Driving records. Currently, staff persons are required to provide 3-year driving records issued by the MVA. All persons and applicants must provide the CEO with a copy of the receipt of payment in order to be reimbursed. Same thing, reimbursements are dispersed. The first reimbursement is done after services are rendered at your first paycheck being with the organization. And also we require a valid driver's license and valid car insurance. When it expires, we need to get a copy of the new one. Last but not least, credentials of contractors, employees, and all staff persons. So one of the things that we require, and it's a myriad of list of different items that we need, but as it relates to credentials, we need a copy of your highest degree, professional licensure, if applicable, any training certifications, a resume, and a curriculum vitae. This is all of the information that we have and for our outpatient mental health clinic. I hope that this was helpful to you to use as a template to get your individuals up and going within your organization. Thank you.